Hey everybody, this is Dr. Kevin Mobley with Community Chiropractic. We have two locations in the upstate of South Carolina. We have one location in Easley, and we have a second location in Simpsonville. The Easley hours are Mondays and Thursdays all day from 9 to 12 and 2 to 5:30. Wednesdays we're open from 9 to 12. In the Simpsonville office we're open Tuesdays and Fridays all day from 9 to 12 and 2 to 5:30. So what I want to do for you today is our patient orientation class. This is usually a class that we hold once a month in our offices to get people acquainted with chiropractic care and help them understand better what it is that chiropractors do and how we help them with overall health. A little bit about me, first of all. I've been here in the upstate of South Carolina for the last 12 years. Although I've been a chiropractor for 18 years, graduated from Life University, which was then the largest chiropractic school in the world in Atlanta in 2002. And I'm happy to be with you today to explain what chiropractors do and the effects of chiropractic. How many of you guys have said this before? These are dangerous words, but the phrase is, maybe it will go away. In fact, I was seeing a new patient the other day, and it's oftentimes when I'll see new patients and they'll say, it's taken me a while to come in because I thought maybe it will go away. Well, it hasn't gone away. And so typically when we say this, the reason it's dangerous is because when we first begin to have symptoms, such as low back pain, and it's not fixed and it's not corrected chiropractically, oftentimes the symptoms will get worse and will begin spreading to other areas of the body. For example, if you have lower back pain one day and it's not corrected over time, it may eventually begin to radiate that pain down to the legs. And now we have other issues and other parts of the body at play and involved. So these are dangerous words to say. Most people will say them from time to time. But instead of saying maybe it will go away, when you have a spinal related pain, it's always better to go ahead and get it checked first before letting it run its course and thinking maybe it's just going to go away. Some important things to remember about the nervous system. The nervous system is the one system that chiropractors are dealing directly with. Now, obviously, we're dealing with the musculoskeletal system as well, with the adjustments on the spine. However, it is the nervous system which runs through the spine and controls every aspect of the body. So, it is also the most important system in the body. And one of the reasons we know that is because God actually put bone around the parts of the nervous system. So up here we have the brain that sits here, that's encapsulated by the skull, which is hard bone. The brain then becomes the brain stem, and the brain stem descends through the top two bones of the neck. The brain stem then becomes a spinal cord, which travels all the way through the spine to the lower back. And then we have these yellow lines, if you can see that on your screen. These are the nerves that come out of the spine. And those nerves go everywhere in the body and carry information going to every part of the body. So the only way your body actually works and functions on a day-to-day basis is for the right messages to be sent from the brain, down the brain stem, down the spinal cord, and then out these nerves. Without a proper functioning nervous system, a person's health is going to be affected by that. And it will lead to a state of dysfunction. Now, whenever you see the word dysfunction, that D-Y-S root word means difficulty. So, for example, the nerves in the upper neck area, those nerves come out and go up to the head, the face, the sinuses, and the ears. So if one has a pinch of one of the nerves in that upper neck area, then the area where those nerves go to, namely the head, the face, the sinuses, and the ears, are going to have difficulty functioning, and in fact won't function at 100%. So the nervous system is the most important system in the body, and it controls and coordinates all the other systems in the body and all the functions, therefore, of the body. Now, there's four things that will lead to disaster, and we will relate this to spinal health, but it also could be applied to all aspects of health and even other aspects in your day-to-day life. The first is when we put off or we fail to check a problem. This is kind of like saying maybe it will go away. The analogy could be said where you're driving down the road and your car light comes on. And instead of getting it fixed, you let it continue, and it leads to greater issues, which is oftentimes what will happen. The second thing that can lead to problems is when we try to cover up a problem. This could be, if we keep with the car analogy, you've got a car, you're driving down the road and the light comes on, and instead of dealing with it and taking it to the mechanic, you take black electrical tape and you cover up that light. Well, it's not unlike what we do with our bodies. We have a pain and we may take an aspirin or Tylenol or Aleve, and some of these things are indicated at times and not necessarily bad. However, we have to realize that when you do those things and take those things, you're actually covering up what the existing problem is. And therefore, those things that you might take like that to cover up the problem don't really fix the problem. They're simply masking what is actually there. Now, specific to chiropractic, another thing that will lead to problems is when you miss appointments. And this is a big one because most of the time when people come in as new patients, we will, every time they come in as a new patient, we will do a consultation where we're sitting down with a person, finding out what their health concerns are, and then we will proceed with an examination and x-rays. Based on the exam and x-rays, we will determine an appropriate course of care if chiropractic is going to be the solution for them. Now, if it's not, if we look at the x-rays and the exam findings and we determine that a person may need a different type of care for their condition, then we will make the appropriate referral to that practitioner. However, if it's something within our scope and something that we can help with, we will develop a corrective care plan for you to determine, to actually fix the problem, the structural problems in the spine, and then begin keeping it maintained and keeping it well. So, missing appointments is a no-no, because when you miss appointments, you're essentially setting the body back a notch instead of continuing to work with us to help the spine progress and get better. The other thing we have to be careful of is not being too anxious to get well. I mentioned the initial visit when people come in and they talk about their concerns. Well, some of the time these concerns have only been there for maybe a few days or a few weeks. Perhaps with others it's been a few months, for others it's been years. But oftentimes what we find on the x-rays is that even if a person's only been in pain or having symptoms for the last few days or weeks or even months, oftentimes these structural problems, which is the cause for the pain, has actually been there far longer than the pain has been. And so what has been there for years, oftentimes in the spine, will not go away overnight. And in fact will take quite a bit of time to really fix and correct. And so it's important that you're patient with us in that process, just as we will try to be patient with you in recommending the right things and the right amount of time to really get this area that's of concern to you healed and corrected. Now there's a few things we want to cover, and I've already talked to you about this, but essentially that nervous system, again, is the most important system in the body. And as such, it controls and coordinates all the other systems and functions of the body. Now one of the things that happens, and it always happens in response to stress, are what we call subluxations. Now if you look at the medical definition of subluxation, it actually means less than a dislocation. However, if you really look at what a subluxation is, it actually is a misalignment of the spine. And while that sounds very simple on the surface, it actually is very complex. And the reason it's very complex is because the subluxation has a direct impact on the nervous system, which we've already said controls and coordinates everything in the body. So when you have a vertebrae that has moved out of alignment, then it begins to put pressure on the nerve that's coming out of that bone. Then all of a sudden you have issues wherever that nerve is traveling. Now if we look at the different parts of the spine, we've got 7 cervical vertebrae, which are here in the neck area, 12 vertebrae in the thoracic spine, which is also known as the mid-back, and And then you've got 5 vertebrae or bones in the low back, which is called the lumbar spine. So again, subluxations happen as a response to stress. It can be emotional stress, it can be physical stress like falls, injuries, accidents, postural related issues, different things like that. But when you have those areas of subluxation and the bone shifts, you can see how it begins to pinch that nerve. And then once again, it's going to cause issues where that nerve travels. And so that's what subluxations actually are. Now, the question will often come, well, I don't understand when this happened. You know, when I first began to get subluxations. Was it when I took the trash out and I threw the trash into the can and all of a sudden I felt pain in that neck area or arm area? Well, that could have exacerbated what was already there, or it could have created a new subluxation pattern. But oftentimes we see subluxations begin either in utero or at birth. Now, how could subluxations happen in the womb? Well, simply because as the mother grows and the baby grows, the baby runs out of room oftentimes, particularly toward the end of the pregnancy. And so the baby is in a very cramped position, and that postural change for the baby and that postural strain on the baby's head and neck and spine can actually create subluxations in the womb. If not then, certainly as the baby is born, traveling through the birth canal with all the pressures therein to get the baby out, sometimes babies can become subluxated simply during the birth process alone. From the head rotation place on the baby's head and neck to the twisting motion that can be applied or the force applied to a baby's head and neck. It's actually acceptable in studies that I've read for OBs to rotate the baby's head up to 180 degrees, and the average OB applies about 70 pounds of pressure on a baby's head and neck to deliver a baby out of the birth canal. That's a lot of pressure, it's a lot of rotation, and it doesn't go without effects at times, not every time, but certainly many times on the baby's spine. Now, how do we know that a baby is subluxated? Well, oftentimes we'll see subluxations result in these concerns here. So we have ear infections, colic, restlessness, general fussiness, not sleeping well, even nursing issues. How would subluxations affect the ears? Well, we've already said that the nerves in the upper neck area go up and come up and go to the face and the head and the ears, even the eyes. And so if these nerves are getting pinched because of a subluxation there, oftentimes it will result in the ears not functioning properly, not draining properly perhaps, which can then lead to ear infections. Nursing issues are pretty common, and they are often caused, not all the time, but they can be caused by subluxations in that upper neck area. Okay, I've had several babies that we have adjusted. In fact, while I was in school my last year, I took another 120 postgraduate hours in certification, in pediatrics, and got certified in pediatrics. So we see a lot of pediatric patients, we see a lot of pregnant patients in this office as well to help the birth go better. Now, we said subluxations actually happen in response to stress, and we've said subluxations are misalignments in the spine. Well, what actually happens then when you have a subluxation? When the bone shifts out of place, it does cause swelling, or we could say edema. And that swelling is primarily caused because the nerve is getting pinched. So it makes sense that if the bone moves out of place and puts pressure on the nerve, that's going to create heat and swelling on the nerve. Well, the other thing that happens with a subluxation is you get muscle tightness. We could say muscle spasms from time to time. Again, the muscles, which we don't see on x-ray like we do the bones of the spine, but we know the muscles attached to the bone. And so when the bone moves out of place, it can't help but pull the muscles and take the muscles with it and create tightness and stiffness in the muscles. And so oftentimes people will say when they come into me as a new patient, I don't know if this is a bone issue or a muscle issue. My answer is yes. Oftentimes it is both, but oftentimes the muscle issue is actually caused by the bone issue. It's the bone moving out of place that's creating a pull and tightness in the muscles. You also get tenderness and sometimes pain with subluxations. So when the bone moves out of place, there'll always be a tenderness right on the bone, but not always pain. And that's because not all the nerves coming out of the spine carry pain. In fact, less than 15% of all the nerves coming out of the spine carry pain, if you look at the research. So that means then that you could actually have subluxations, have a pinching of the nerves, and it not create pain. So what kind of symptoms might you have if you have a subluxation putting pressure on the nerves that's not going to create pain? Well, it can create other issues with the muscles, create muscle tightness, muscle stiffness, muscle atrophy. Might also create other organic disturbances. That's run by the autonomic nerves. So it is very common for people that have lumbar subluxations, again in the lower back, to have other issues like constipation or the other extreme diarrhea, or maybe kidney or bladder issues or heartburn. These are all things that are organic type problems and symptoms that all have a cause and effect. Many times, again, not all the time, but many times have the cause and effect related to the nerves getting pinched in that lower back. And then finally, when you have subluxations, the joints get restricted. They don't move as well. And that's again caused by the bones being out of place, creating tightness in the muscles. Now, let's say you have spinal related pain. Maybe you don't go to a chiropractor. In fact, many of you are in this boat. Many of you come to me as a new patient, and you've already seen a lot of other providers in the medical community for your spinal related pain. And oftentimes, the treatment will be some form of medication, maybe painkillers, maybe muscle relaxants, or it may be anti-inflammatories. Well, all three of those things are appropriately named, but all three of those things really treat the symptoms of subluxation. So painkiller, for example, kills pain. Well, that's going to help with the tenderness and the pain that you have from a subluxation. Anti-inflammatories mean against swelling. You get swelling from subluxations. Yes. What about muscle relaxants? Muscle relaxants relax muscles. You also get muscle tightness and stiffness from subluxations, right? So when you take those medications, any one of those or all three, you essentially are treating the symptoms of a subluxation. And that's why, while those medications are not altogether bad, they just don't really fix the problem at hand. Now, oftentimes, we will have somebody, not that often, but some of the time, we will have somebody come in and they'll do very, very well with chiropractic care, but maybe they need collateral care, meaning they don't need to discontinue their care here with chiropractic, but maybe we need to employ the use of another physician to help on the medical side of things. And oftentimes we will make those referrals to the needed physician to help with a symptom standpoint or maybe the swelling standpoint while they're also continuing to come in for their adjustments here. So that's what actually happens physiologically when you have subluxations in the spine. Now, what do we do as chiropractors to correct the subluxations? Well, the term is adjustments. We don't crack the spine, we don't manipulate the spine. Manipulate means to change. We are changing the alignment. But a better term for this is an adjustment. We are actually adjusting the spine and we're moving the bones back into their normal alignment pattern. And realize in doing that, it sounds simple again, kind of like a misalignment sounds simple, but as we've looked more into it, it actually is pretty complex. And so because of the adjustments affecting the nervous system then, the effects of the adjustment are widespread, but readily researched throughout the literature over the last 100 years. And the adjustments are actually putting the bones back into place, allowing the nerves to work better, leading to less muscle spasms, and really just allowing the body to work better. That's what we do as chiropractors, and that's what we do by doing the adjustments when people come in visit to visit. Now, here's some changes that we've seen, pretty dramatic changes that we've seen on x-ray. Typically, again, when somebody comes in, if we determine that they are a candidate for chiropractic care, we'll prescribe a course of treatment for them and for their specific condition. Then at the end of that, we will reevaluate, and we'll also take new x-rays so that we can determine what kind of objective changes we've made. This was a lady that came in with neck pain, and you can see how there's really not much curve there. She's facing this way. This is the back of her head. This is her jaw. And we measured that curve, and it only measured 5 degrees. Well, a normal curve should measure 40 to 45 degrees. At the end of 90 days of treatment in our office, her curve went to this, which is now 35 degrees. So she changed from 5 degrees to 35 degrees over a period of 90 days. And that was a result of doing adjustments here in our office, plus doing some tractioning at home. Now, while I'm talking about adjustments, there's over 200 different techniques, ways we could say, to adjust the spine. At times, really all the techniques are either based upon more speed or more force, and we really use a combination of techniques based on the specific individual. So we will do a combination of, if you're familiar with chiropractic, a diversified technique, which is more of a hands-on. We also utilize Thompson technique, which is a use of drops for the lower back particularly, and the pelvis. And we also will use activator from time to time, which is a handheld instrument to adjust the spine, and it does so with very little force and very high speed, which is why we can see babies out of the womb. It's also why we can see patients on up into their 90s and even over 100, simply because we can do the adjustments with the activator and not create much force in the spine and still get the job done. So we have our oldest patient now is 99. We had been adjusting over the last couple of years, people even over 100. Our oldest patient just passed away last year at 106. And so we see patients all different phases of life, all different ages, all different conditions. But that's an example of the type of work that we do here in our office. Now, here's another lady that came into us. Her curve in her neck was better than the previous one we saw. Her curve started out at 19 degrees. At the end of her 90 days, she got up to 28 degrees. So it was about a 50% change, which was pretty dramatic, and she was feeling great. She had other health concerns that became more of a priority to her than continuing through routine maintenance chiropractic care. And so she gave more priority to those other health conditions after we took this x-ray that showed 28 degrees. So she was away from our office for about a year. She didn't come in. And then she came in 12 months later after this x-ray was taken at 28 degrees, and she was having neck issues again. And we took the x-rays. She was all the way back to 19 degrees. So if you can follow me on this for a second, she went from 19 degrees to 28 degrees in just a period of 90 days. Well, then over the next course of 12 months, she lost every bit that she had gained. If you do the math on that, she actually lost 3/4 of a degree of curve in her neck for each month she did not get adjusted. And so it really showed objectively, certainly it showed her objectively, the need to continue to maintain the correction that we've made in her spine through chiropractic care. And I'm happy to say she continues to come in this day to maintain this correction that we got the second time around. Now, there's some things that you can do on your own that will help accompany the adjustments. These are not necessarily standalone things that will fix your problem without chiropractic care. However, when taking these things into account and doing these things on your own, work really, really well in getting even better results with chiropractic care. course, we've talked about before, cervical refers to the neck area. Lower back refers to, or lumbar refers to the lower back. So simple range of motion stretches are important to do. The cervical stretches you can do sitting or standing. Cervical flexion is simply looking down like this. Extension is looking up toward the ceiling. Rotation is turning to each side. And then lateral flexion, lateral mean side, so ear down to the shoulder. A lumbar, you have to do these standing. This involves bending over toward your toes, that's flexion. Extension is back this way. Rotation is turning to each side. And then lateral flexion is hand down toward the side of the knee. Now, each one of those stretches is important for you to be doing. And each one of those stretches needs to be held for about 5 to 10 seconds when you do them. So this is not a quick thing that you can go through. It doesn't take that long, but it shouldn't be a real jerky motion. It should be a real controlled stretch, holding it for 5 to 10 seconds. The other caution I will give to you on this is make sure you're not bouncing. So particularly folks that can't reach their toes, don't try to bounce in an effort to reach your toes. It's just a stretch and hold, and those things will help you. How you sleep is important. It's very important that you sleep either on your side or on your back. If you're sleeping on your back, and particularly if you have lower back issues and concerns, you want to make sure you have a pillow here below the knees during the night to alleviate the strain on that lower back. If you're a side sleeper, which is another good position, you want to make sure that you take a pillow and put it between the knees and run it down between the ankles. That'll keep the hips level and the low back from getting strained as well. So that's a huge thing for you to begin doing even now while you sleep. Now, another thing about sleeping while you're on your side is you want to make sure that you're maintaining a 90-degree angle when you're sleeping on your side. So your head and shoulders should be at a 90-degree angle. You should not be, if I'm sleeping on this side, you should not be on that pillow that you've always loved and had for 20 years and your head is way down like this. You also shouldn't be on a couple of pillows to where your head's going the opposite way. It really needs to be at a 90-degree angle. Now, how you sit at a computer is also very important. And of course, nowadays, we have laptops and tablets and even phones now, which do everything for us, and where people are constantly on them. What I would encourage you to do is try to make sure that your posture is correct and that your head and neck are actually facing the screen. The screen that you're looking at should be at eye level. So even on your phones, when you're on your phones, instead of doing like this, you want to try to bring it up in front of you and again be looking at the middle of the screen. That'll alleviate any strain on that neck area. So those are some basic things to begin doing even now as you begin your chiropractic journey that'll really help in this process. Any other questions that you all have, please talk to me on your next visit here. If you're not a patient here and you'd like to get more information about our office, you can check us out on the website at communitychiropracticsc.com. You can also follow us on Instagram and Twitter and Facebook and all these other social media platforms. We look forward to interacting with you through those means and hopefully being able to meet you soon. For those of you that are patients, we look forward to you continuing care and you getting the very best care from chiropractic care. Thanks for your time today.